Hello and welcome to Community Pulse. My name is Levi Moore. I'm one of the 3 rotating hosts of Community Pulse, and our guest today is Allyson Hansen. Let me get this right. The CEO and Executive Director of the Illinois Medical District. So, Allyson, thank you for coming. And, first, I've got some, housekeeping to do. Okay. Community Pulse is a public affairs show about public health in Chicago. In terms of the organizations involved, Community Pulse is sponsored by the Hektoen Institute of Medicine. Hektoen is a not-for-profit in Chicago that's been around for 80 plus years, assisting in public health. Hektoen also sponsors the Foxglove Alliance. My title is Foxglove Alliance Coordinator, and we do this show in a partnership with the Healthcare Council of Chicago and Foxglove's Nurses and Humanities program. So, I always get that jumbled, even though we've been doing this for almost 2 years. There's a lot to remember. So, with that out of the way, but first, let's get to know you better before we go into the IMD. So, what is the Allyson Hansen story to how you got here today?
Well, first of all, thank you, Levi, for having me. It's so great to be able to continue to, support what's happening here in the Illinois Medical District and also share what we're doing, what we're up to. My background, I have a master's in health administration, and so my journey, my career has really taken me from South Carolina, where I grew up, through Atlanta, and finally here into Chicago. I've been in Chicago for 25 years, and so the majority of my career being here locally, working with both academic and community hospitals. And then I took a pivot and I went into private equity. Private equity has been and continues to, along with venture capitalists, buy up clinics, other elements of healthcare, and bundle those for resale. And it was really fascinating to me, like how are they doing it? What's the initiative? What does that look like? Why can't hospitals do that for themselves? And so I spent some time with private equity, and then what I learned from that was, for private equity, it's all about the exit. It's all about selling whatever they've assembled. But it was less about taking care of the environment that surrounded, or sometimes even the people within it. So this opportunity, when it presented itself at the Illinois Medical District to be CEO and Executive Director, and I think it's important to talk about why 2 titles, right? Because that's a little different. Healthcare recognizes the CEO title as the leader of that organization. Government agencies recognize Executive Director as the leader of that organization. So really, depending on the direction I'm facing and who I'm talking to, I want to make sure that they understand the level I'm at, and that there's an opportunity to talk to that individual at that level within that organization. So I came to the Illinois Medical District because here's an amazing community. We've been around since 1941 as a government agency, really caring for this west side of Chicago, 2 miles west of downtown. And I saw it as an opportunity to bring my background of healthcare, which is the industry we serve, along with education and innovation, into my care of the experience of being in a community, being in a place where you're going to learn and live and hopefully play. And so that's why I'm here. That's what I'm passionate about. I think what you'll see under my leadership is, continued growth of green spaces, continued growth of activities for those that we're serving, so that when you do need a hospital, you're there because of your disease state and not your mental health or your fitness ability.
Yeah. Now, just to clarify, because this confuses a lot of people, that you're not a nonprofit, and you're not part of the city of Chicago, you're not part of the state of Illinois. So how would you, just...
Well, we're quasi-governmental. So I like to, when you think about the Illinois medical districts, we're a geography. We're 560 acres. We're Ashland to Oakley. We're Congress down to the intermodal, which is 15th, 16th. And so we're a place. We're an identity. But we're also a commission. A small group of individuals formed by state statute to care for this 560 acres. And what we have within our geography are lots of stakeholders, FBI, Red Cross, Medical Examiner's Office, but also 4 amazing hospitals, 2 universities. So we're really meds and eds here in the IMD. But the goal of the commission is to really care for and continue to promote inclusive economic growth. So we still have the opportunity to develop and do more in the district. And the intention when we were set by a state statute was that our goal is to make sure that that inclusive economic growth really serves the health and the care of the population that's here. So, that's our infinite goal. That's something that will always be in service of. And while I'm here, I'm taking strategic tactical moves to get us to our larger plan.
Now, there was this little event that occurred this summer.
Tiny.
Yeah, Democratic National Convention.
Yeah.
And the one thing I saw was that it was a situation where you kind of saw all of the elements, all the players in the IMD sort of coming together and various. So just describe, what your role was and what you're involved in, because I'll probably give people a really good sense of who's here.
Yeah, so the Democratic National Convention, we have, I should also mention my board, who I report to, is appointed by the governor, the mayor, and the Cook County president. So we're really an interesting quasi, agency because we have that kind of oversight within. But the DNC gave us a really unique opportunity to not only forge our identity of having this amazing medical district in Chicago, but also work with our stakeholders. So we planned a lot of things in preparation for the DNC. It's a 5-minute walk to get to the United Center from the IMD. And so just the geography of being a pedestrian or somebody driving to the DNC or coming to one of our hospitals was going to be impacted. So we pulled together regular calls with our stakeholders. We attended 5 of the 22 subcommittee meetings that were held that were going to impact the IMD, health and hospitals as an example. And we shared that information back with our stakeholders and also provided a platform for them to share with us. If they were concerned about safety and security and protesters, then we made sure we really understood what is the plan. And if they were concerned about roads being closed, then we communicated the vital roads that are used by our stakeholders, by our hospitals, by our universities who were going to be starting their classes, so that there was at least an understanding with the DNC in terms of what type of impact that has. And that's really how we see ourselves, as a convener to solve those problems that no single entity could solve on their own. That is something we can do. We can bring people together and we can be in conversations and we can take action and take steps to make sure that not only are people heard, but we can also, add cameras to areas that we feel are unsafe. So we were very involved in the DNC, and then I'll also add quickly, we also planned fun things. We wanted to have a celebration during the DNC and recognize the IMD as a community that's thriving. And so we planned a fall festival or a DNC festival where we had the ability to have some of the local talent come out and sing or do artwork with us. And so
the tacos were great.
Yeah, the tacos were great. It's sort of the pride campaign. We want civic pride to be here in the IMD just as it is in many of the other communities in Chicago.
Well, just a little aside, I work in a building called the Vertiport Building. It's a helicopter building, and it's literally the next door neighbor of CAN TV. And for about 2 months, we just saw a lot of black, large helicopters coming in. And it's like, well, we probably better not ask many questions. Okay, you are the third head of the IMD that I've known. I knew Warren Ribley really well because we both came from the same state agency. I knew Suzette when I first came over. And you touched on it a little bit, but can you kind of go more into your strategic plan, the councils, and just, your stamp on the IMD?
Yeah, it's a little different from what the past executive directors have done. Warren brought a lot of knowledge around government and DECIO and other elements that really helped to shape how we can get funding. We are self-funded as an organization, so anything that we bring in through any ground leases we're doing or buildings that we're leasing, that's really what supports us. We don't rely on the state or taxpayers. We are totally self-sufficient. But we have this desire to do more for our community. So Suzette coming in, she really focused on life sciences and development and gave us an edge in many ways, helping to recreate our logo, our brand. And now in my time here, the focus is really back on the community. It is creating, I like to call it curb appeal. It is creating that kind of place. I worked at UI Health, which is here in the IMD, and my doctors would complain they can't get a good cup of coffee. There wasn't a place to go get lunch that was really close by. Taylor Street was there, but there really wasn't anything in the IMD. And that had a lot to do with our zoning, but it also had a lot to do with the fact that the focus had not been on the community and what could happen there. And so creating green space, creating councils, community councils that come together. We have 10 active councils. Including safety and security, arts that you're on, infrastructure, many others. I also have an advisory board of the CEOs and university presidents that work with us to help guide us in terms of what we need to do next. And so this, the combination of these councils and our strategic focus, which comes from our master plan. You can find it on our website. But from that, we create an annual strategic plan that really charts where are we going this year. And so we're really rooted in process thinking on how we improve this community and make it not only livable, a place where you can work and a place where you can learn, because we have those, but also a place where you can play. Yeah, get outside, enjoy it, get a respite, because we're a 24/7 environment and these hospital workers don't stop. And so they deserve a place where they can go outside and breathe, and so does our community.
Okay, let's talk about a couple of projects. One, I better mention it or else I'm going to go back to work. The IMD and Hektoen are working on a little project together. Do you want to go into it or...
Yeah, I can. Yeah. Absolutely. So if you haven't been to the IMD lately, go down Ogden. As you cross, headed south over Congress Parkway and 290, you're going to see our great new Welcome Plaza. Big IMD letters, place to sit and relax. It's sort of the first stake in the ground to say we're going to be the kind of community that encourages you to come out. The second is what you're referring to, Levi, which is 2023 West Ogden. We just demolished a building on that 1 acre triangle parcel, and the goal there is to create our second inviting green space. And what we love about this is this space has the true intention of honor, remembrance, and resilience of our healthcare workers during the pandemic. So there's an opportunity working with Hektoen to create a monument that they're working hard on raising the funds for. And in the meantime, we've hired a site designer to come in and create the look and the feel of the green space. It's not a one-year project because it's going to take a lot of funding, but it is a multi-year project to really move us to have the type of place where you could come together and listen to a small band, read poetry, eat your lunch, see something beautiful, create a traffic calming, because when you have beautiful things that you're passing as you're driving by, you often will slow down to appreciate it and acknowledge that. And so Damon, Ogden, and Polk, that triangle parcel will really be something I think we can all be proud of in the coming years.
The other project was, well, the Fossil Alliance. The Fossil Alliance. No, did a little soft launch on a new initiative, and it's called the Foxglove Alliance Innovation Initiative. And the whole rationale behind that is that right before our eyes, as we speak, Chicago is becoming a global medical health innovation hub. And when you look at who was already here, like the IMD, but then Zuckerberg,
Sure.
the Discovery
DPI.
partners, and from your purview, I remember I asked you a question maybe about a year ago, and the answer was kind of bad, but it's like, how much coordination is going on with that? And you said, well, it could be improved, but okay, what's your perspective on where Chicago is in that position? What can be added? What is the IMD doing to help further that?
Yeah, I think there's always more we can do. We're definitely growing, and we're starting to see life sciences and innovation make its way to Chicago. I mean, we have a lot if you think about it. I've seen on the Foxglove Alliance the amazing pictorial you have of the bubbles of everything that we have. It's pretty dynamic.
When you look at it, it's like, oh wow,
yeah,
like that's already here, folks.
That's already here.
Yeah.
But the fact that we know we can do more, and the East and West Coasts are definitely outpacing us, the question we have to ask ourselves is, how do we improve? And so in our strategic plan for the Illinois Medical District Commission, we have 4 pillars. Community is one of them. We've talked about it. Identity, growing who we are and name recognition. Collaboration, which we've talked about. We haven't talked about innovation. And I think that's your point. And, I met last night with some leaders in this realm, and we're all asking ourselves the same question. Like, what's it going to take to start to come together and have sort of non-competitive conversations around what we're each doing to attract life sciences into our area, and how do we support each other? Because the win is for Chicago, and the win is for the state. It's not about the Illinois Medical District winning or any of the competitors that are out there, what they're planning, because the minute we start to attract more, it's going to have a downstream effect, and we're all going to win from that. But I think that was our conversation last evening, is how does that begin? And I think it begins with people who care about bringing innovation here and are just in the conversation and starting to talk about what some of the roadblocks are. Financing would be one of them in today's market.
And one of the things that I've been good concerned about is that where are all of these workers going to come from that they're going to need? And meaning that a lot of the new developments they've talked about, especially things that will be involved in like medical clinical research. And there was some really good news. I always thought that you had to have like a master's degree, but they found out that a lot of these positions, if you have an associate's degree and a couple of certifications, listen to this, 17-year-olds in Chicago. If you can pull that off, you will have a career.
Yes.
And you will get additional training, because the companies will pay for it. So that was, it's something that I've talked to actually some of the people in business. It was an old colleague said, guess what? Healthcare and the business community are about to converge.
Right.
Because your problems, available workforce, are the same. And there's this new wave of we have healthcare, technology, and business all converging together. But it's a good problem.
It is a good problem. And I teach a course at Loyola to the Masters of Health Administration students, and I tell them that, like, if you work in healthcare, there's a job for everyone.
Yeah.
It's basically a small city. I mean, you need all kinds of workers, and they're always looking to promote from within. And I think that's, the naming convention of Illinois Medical District is a beautiful one, but it also can be daunting because people think, well, that's only medicine. That's only for doctors and nurses. And the truth of the matter is so much of what happens in the IMD, it requires all levels of education. And to your point, Levi, the dentistry school at UIC, for example, they will train you how to be a technician. You don't need any degree. They will train you for that. So there is a career here for everyone. And the other thing we're really proud of having two universities here is we also, and a great community college just across the interstate in Malcolm X, and of course 7 great city colleges, is we make the people here. Like we make who will be later working in these technology industries and these innovation industries, and we need them not to leave. We need them to keep their wisdom here and not take it to other places, because that's really the beauty of a full cycle opportunity.
I mean, that's the problem with nurses right now. It's like they're being poached by other areas.
Right.
But you know what? The IMD is not the only medical district in the state of Illinois. But how are you all similar? How are you different?
Yeah, there are many other medical districts and emerging medical districts. And I would say how we're different is we're the largest urban medical district in the nation. So we're fully formed. We're not trying to find our stakeholders or our anchor partners. I mean, they're already here, and we've been at this for, over 75 years. So our focus today is different perhaps from the Mid-Illinois Medical District or Roseland Medical District, in that they are forming and starting to pull together their resources to create the medical district that they envision themselves to be. So a little bit of a different pathway, but we see ourselves, again, non-competitive. We want to help, and we've met with those agencies, and we want to lean in and say, if there's more of this, it will be good for Illinois.
Okay. What have been some of your current challenges since you've been in the job? And then we're going to look into the future.
I think current challenges are funding. We aren't a not-for-profit, right? We don't have a foundation today. And so finding funds to support the community is something that we're always up against. So we've started writing for grants, and that's what funded the Welcome Plaza, and certainly will help us with 2023 West Ogden. So we're continuing to look for funding opportunities. And like I tell my team, it's all a give back to the community. What we find, we want to roll back in, because that is what's going to make us, succeed in the future.
Okay, and going forward, where would you like the IMD to be in 5 years?
Yeah, so again, we're an infinite game.
Yeah.
Where there's no winning and losing. We're playing at this forever. I think what I'd like to see is more housing, more affordable housing. More green space, so more parks, more recreation. We've got a beautiful Rise to Shine 5K, 10K, all-inclusive race happening on Sunday through the Chicago Lighthouse. More of that. More opportunities for our community to come out. More play, connected to the United Center and what they're planning with their 1901 project, the Blackhawks, and certainly the Chicago Fire with their new practice field just across Ashland. So I really want to connect to these communities, and in 5 years, I hope you see that. Not only can you bike to them, walk to them easily, get to our transit nodes, and we have many of them running throughout the IMD, but I want you to feel safe and drawn to the IMD as a destination, not only because you want to get healthy, but also perhaps because you just want to play.
Yeah, well, it's funny. A lot of the oxygen has been sucked up by the potential Bears Stadium and Bright Sox Stadium. And I remind people, like, did you hear what they announced they're going to do with the neighborhood around the United Center? It's going to transform probably this part of like the Norwest Loop.
Yeah.
I mean, it's essentially a $7 billion development over multiple years that is going to have commercial, residential, recreation, entertainment, and it's right next to the IMD.
It's going to be a lot of fun. Yeah.
I know it's going to be time to wrap up soon, but let's kind of go broad, wide. In terms of public health, where are we at in the city in terms of what we're doing in public health? What do you think needs to be added, and maybe not? Does this impact anything you do in terms of like who you try to recruit to the IMD?
I mean, I think it does because it needs to serve our industry. I think if we have a focus area, it's two. It's health and wellness. We've talked about that. But it's also mental health. And that's a crisis we're in. And we really want to focus on and make sure that we're providing as much information to our community as possible when it comes to mental health. So you'll see a lot of programming around that over the coming year.
Okay. It's time to wrap up.
It's been fun.
Allyson, thank you so much. And the first time we ever really got to talk, I was still chairman of CAN TV, and we took Allyson on a tour. So welcome back.
It's great to be here.
Okay. Once again, my name is Levi Moore, and I'm the Foxglove Alliance Coordinator. And with my partners, Hektoen's Nurses in the Humanities and the Healthcare Council of Chicago, we hope that you watch this show and the shows that Decorah Love and Megan Phillip will be airing over the next few weeks. And in December, which is right around the corner, we're going to do a double show year-end wrap-up. So with that, thank you, and please watch again.
Bye.